Hello friends, today we discuss about constipation. Constipation is a problem with passing stool. Constipation generally means passing fewer than 3 stools a week or having a difficult time passing stool. Constipation is fairly common. A lack of dietary fiber, fluid, and exercise can cause constipation, but other medical conditions or certain medicines may be the cause. Constipation is usually treated with changes in diet and exercise or with non prescription medicines. Constipation may require medicines changes in medicines or other treatments prescribed by a healthcare professional. Long term constipation, also called chronic constipation, may require treatment and a disease or condition that can cause or worsen constipation. Symptoms of constipation include fewer than 3 stools a week, hard, dry, or lumpy stools, straining or pain when passing stool, a feeling that not all stool has passed, a feeling that the rectum is blocked, the need to use a finger to pass stool. Chronic constipation is having two or more of these symptoms for 3 months or longer. When to see a doctor. Make an appointment with your healthcare professional if you have constipation with any of the following conditions. Symptoms that last long than 3 weeks. Symptoms that make it difficult to do everyday activities. Bleeding from your rectum or blood on toilet tissue. Blood in your stool or black stool. Other unusual changes in the shape or color of stool, stomach pain that doesn't stop, weight loss without trying. Causes, patterns of bowel movements vary from one person to another. The typical range is 3 times a day to 3 times a week, so it's important to know what is typical for you. In general, constipation occurs when stool moves too slowly through the large intestine, also called the colon. If the colon moves slowly, the body absorbs too much water from the stool. The stool can become hard, dry, and difficult to pass. Lifestyle causes. Slow stool movements may happen when a person doesn't drink enough fluids, eat enough dietary fiber, exercise regularly, use the toilet when there is an urge to pass stool. Now, problems with pelvic floor muscles, the muscles that hold up organs at the bottom of the torso, are called the pelvic floor muscles. The ability both to relax these muscles and to bear down are necessary to pass stool from the rectum. Problems with weakness or coordination of these muscles can cause chronic constipations. Blockages in the colon or rectum, damage or changes to tissue in the colon or rectum can block the passage of stool. Also, tumor in the colon, rectum, or nearby tissues can cause a blockage. Other factors, a number of conditions can affect the work of muscles, nerves, or hormones involved in passing stool. Chronic constipations may be linked to any number of things, including irritable bowel syndromes, diabetes, multiple multiple diseases, nerve dysfunctions or damage, overactive thyroid, also called hyperthyroidism, Parkinson disease, and pregnancy also. Sometimes the cause of chronic constipation cannot be found. Risk factor. Factors that may increase your risk of chronic constipation include being an older adult, being a woman, getting little or no physical activity, having a mental health condition such as depressions or an eating disorder. Complications of chronic constipation include swollen tissues around the anus, also called hemorrhoids, torn tissues on the anus, also called fissures, hard stools backed up into the colon, also called fecal impactions, export tissues of the rectum that have slipped out of the anal opening, also called rectal prolapse. Prevention. The following tips can help you avoid developing constipations. Eat lots of high fiber foods, including vegetables, fruits, beans, and whole grains foods in a daily wise. Eat fewer foods with low amounts of fiber, such as processed foods, dairy foods, meats. Drink plenty of fluids. Stay active and exercise regularly. Don't ignore the urge to pass stools. Create a regular schedule for passing stool, especially after meals. Now we discuss about foods for constipations. If you are experiencing constipations, difficult or infrequent bowels movements, what you eat can make a difference. Certain foods can help bring about relief while others can make the problem worse. Diet and constipation. Constipation can be occasional or chronic, and causes range from a sedentary lifestyle to gastrointestinal conditions such as irritable bowel syndromes, IBS. But in almost every cause or case of constipation, foods is an important factor in our life. Fiber is a major component of foods that relieve constipations and pop itself in addition to adding bulk to the stool. Fiber and high fiber recipes provide other digestive benefits. Fiber supports the microbiomes, the healthy balance of bacteria in the digestive tract. Fiber also helps gut mobility, the coordination of muscles contractions in the intestine that push food along the digestive process also. Foods high in fiber. There are two types of fiber found in food, soluble fiber and insoluble fiber. Foods rich in one or both kinds can relieve both occasional and chronic constipations. Insoluble fiber is what we think of as this is the material from food that your body cannot break down in digestion. So it leaves the body pretty much as it goes in. Foods high in soluble fiber includes skins and seeds of fruits and vegetables, popcorn, leafy greens, nuts, dried fruits. Soluble fiber. Soluble fiber, on the other hand, is a type of fiber that dissolves in water. When dissolved in water in the digestive tract, soluble fiber forms a gel that adds bulk. The gel also acts as a natural stool softener, making bowel movements easier and more comfortable to pass. Soluble fiber can be found in whole grains, apples, bananas, cooked vegetables, and oatmeal. Some of the recommended foods for constipation includes both types of fiber. For example, potatoes and apples have soluble fiber inside and insoluble fiber in the outer skin. Eat more fiber to relieve constipation. If you are dealing with occasional constipation, upping your fiber intake for a few days to get back onto a more formal for you bowel movements schedule can be sufficient. For chronic constipations, consider consulting with a dietitian who can help you create a more fiber rich long term eating plan. A typical approach works up to 25-30 grams of fiber a day for women and 30 to 38 grams for men for constipations. Increase fiber gradually. But the experts advise that when making dietary changes, easy does it. If you are used to eating a diet low in fiber, incorporating a low of fiber all at once can cause gastrointestinal or gastrointestinal symptoms such as gas, cramping, or bloating to actually worsen. The goal is to gradually add in more high fiber foods so your digestive system has a change or has a chance to acclimate. Are there foods that make you pop instantly? In addition to fiber, prawns are rich in naturally occurring sugar, alcohol, called sorbitol. Sorbitol molecules do not break down in digestion, and when they reach the colon, the body wants to get rid of them, and the reaction can result in a bowel movement. Apple juice also contains sorbitol, but in lower amount for people who do not like prawns or prawn juice. Apple juice can be an alternative. So drink more water for constipation. Experts also stress the importance of adequate hydrations. Water is essential to helping fiber work its magic. The large intestine draws water out of the stool before it's passed out of the body. So if you are hydrated due to exercise, hot weather, a medical conditions, or just not drinking enough water, you can end up with hard, dried out stool that is more difficult to pass. As you increase your dietary fiber, it's important to increase your hydration at the same time. Can exercise help constipations? Yes, physical activity is essential for you even if you do not feel like exercising because you are constipated and bloated. Moving your body will help you move your bowels. Foods to avoid when constipated. High fat foods, those rich in oil, butter, grace can contribute to constipation. If you are chronically constipated, overeating, fried foods, processed meat, commercially baked goods, and other high fat items may be responsible. Cheese as a particular constipation culprit. Fats are tricky to digest and take a long time for the body to break down. Also, most high fat foods are low in fiber and delay mobility also. If someone is constipated, does it matter when they eat? There is not much research around this, but the process of eating stimulates the digestive system end to end. So, at end, theoretically, keeping a regular daily meal schedule could support regular bowel movements. So, be healthy in your life and always consult your doctor for your a healthy life. Thanks again for watching my videos.